Question many clinicians and lab technicians ask, why does dental zirconia break? Zirconia is one of the strongest materials in restorative dentistry, but failure often happens due to preventable mistakes. Let's walk through the most common causes and how to avoid them. Zirconia is strong, aesthetic, and biocompatible. However, it's not immune to breakage. Failures usually result from missteps during the workflow, not from the material itself. Here are the most critical factors. 1. Excessive heat during milling. Overheating zirconia during dry milling or poor cooling leads to internal stress and microcracks. These microcracks may be invisible, but they reduce long-term strength and increase the chance of fracture under functional loading. 2. Dull or worn milling tools. Using blunt burrs creates vibrations in rough surfaces. This weakens the internal structure of the restoration. Tools must be regularly inspected and replaced to maintain milling precision and avoid introducing stress points. 3. Poor CAD design. Digital design is a crucial step. Thin connectors, sharp angles, and inadequate wall thickness compromise durability. Designs must account for occlusal load. 4. Incorrect sintering protocols. Sintering activates zirconia's strength. Under-sintering leads to porosity and low density. Over-sintering makes the material brittle. Each zirconia type has its own sintering schedule. Always follow the manufacturer's instructions precisely. 5. Cementation errors. Even a perfectly milled crown can break during seating if handled incorrectly. Using excessive force, improper tools, or ignoring marginal fit may cause internal fractures. Cementation should always be gentle and well controlled. 6. Post-sintering adjustments. A major risk. Modifying zirconia after sintering, such as grinding or margin reduction, can easily introduce microcracks. Key insight: all adjustments must be made in the green stage, before sintering. In this pre-sintered state, zirconia is softer and safer to shape. After sintering, any mechanical adjustments should be minimal and carefully polished. Never aggressively ground. 7. Inferior material quality. Not all zirconia powders are equal. Low-cost materials may contain impurities, leading to inconsistency, weak bonds, and aesthetic limitations. For high reliability, choose zirconia made from Toso powder, known for its strength and purity. 8. Clinical misuse or case selection errors. In some cases, failure happens not in the lab, but in the patient's mouth. Factors like bruxism, heavy occlusal forces, or poor case planning. Thanks for listening to Troubleshoot Podcast. If you found value in this episode, please follow, share, and stay tuned for more. Until next time, refine the process and your zirconia will perform flawlessly.